we're talking about what advice we have for the policymaker government at this time. So we talk about investments in us, continuous investment. That's the word. Continuous investment, motivating those at the front lines, and seeing how much they can be relieved because of the heavy work they are doing. I mean, how they can be motivated is very important. They are doing it, but they need to do better, right? They need to do better. Another thing is that nurses truly have the ears of the people at the community level. If you check it out, they are like gods, they are like mini gods at the community level where they are supposed to function. Public health nurses truly have the ears of the people because of the kind of training they've gone through. They should allow the nurses to function at this level. Allow community health nurses, public health nurses to function to the full capacity. Let them know that this training that they have had is useful at this level. And that's very important. They should allow them to work to full scope. Talking about, talking about community, everything community. You see the public health nurse on top of this. Allow them do it. And it's one of the most cost-effective ways of achieving all those target goals at that level. Another thing we need to advise that we can, advice we can give them at this time is that deploy them.
Okay.
Deploy them at times like this. Deploy them. Use them. And not just use and dump. Celebrate them. Tell them that these are the people that are getting the job done. Another thing that is very important is a missing link. And we're not doing well as a nation. I don't know whether other nations are doing well as a nation. We are not doing well. For people who are going to execute at the community level, we expect that they be brought in at the level of planning. You cannot be planning things and not thinking of the people who want to go and execute. So that they can give useful contributions and then we can achieve these targets as we have said. Not that you are sitting down in one boardroom and one place and then you now say, okay, this is what we want you to go and do. And they don't get it. And they're like, factor this in, have you considered this? So the public health nurses need to be brought in at the level of planning. Not just for them to go and execute. It's very important because what they say is important.
Thank you very much. Thank you very much for that beautiful response. I think my viewers, they will discover in this chat, they've seen that my guest has highly digested and dissected the topic very well, and we can see clearly that my guest is knows exactly what is happening. So she's talking with authority, and she has the everything at the tip of her fingers. And I think I will still have to invite you for another season, but that will be basically for another topic, because you raised one pertinent things that I think is very important, and we are going to discuss that next time on how legitimate they are, because we discovered that they just have the certificate, they are not being deployed, just as you've said. So what is the essence of producing public health nurse and they are not being useful? I think it is something we are going to discuss when next time I'm going to have you on my show. Lastly, advice to the general public, to the layman. What should I do? I wear my mask, wash my hands.
Before I take, sorry, let me just, there's something on my mind concerning, before I give my last words to the general public, is that I want to tell nurses at this time and midwives. You know why I'm a midwife, so I'm a proud one, right? So I keep talking about them. Because midwives are the, if you are looking for anything public, is midwife, right? Midwives.
Yeah.
Markets. So, right? Okay. All right. So one thing I want to tell nurses and midwives at this time, especially public health nurses, is we need to build capacity. We need to build capacity. I want to tell nurses and midwives like that. They need to build capacity. I'm happy that a lot of learning hubs opened up for free, especially during COVID, hubs that you wouldn't have had access to on a good day. You had to pay a lot of money to access it. So they opened up for free. And I hope nurses are really taking advantage of all this, right? It's very important. So nurses should please build capacity. We need to build capacity. It's not just saying, I've gone to school of nursing or have a master's or something. Nurses need to be on top of their game. Not just talking. Do, like somebody say, don't talk too much. Do much more and let people see your actions, right? So it's very important. Another thing is nurses should, I've said about, I talked about it when I said we should leverage on digital technology. But another thing we also need to learn how to do more is being able to communicate to people who cannot speak your local language, people who cannot even hear. We have vulnerable with physical challenges. I know our training did not do that for us. I don't even know any education curriculum, any health curriculum in this country that takes you through, dealing with health and all of that. What happens to them at this time? It's going to be difficult for nurses to connect with them because they don't have the skills, they don't have what it takes to communicate with these people at this time. So that's another area that nurses should go and develop capacity in. Check courses online, see what you can read up online, look at communities you can access. The blind people, how would they understand COVID-19 and hand washing and all of that? I mean, learning how to communicate with all these kind of people across board, ability to reach them wherever they are. And of course, with technology, you can do anything. So that's one advice that I don't want nurses to sweep under the carpet. To whom much is expected, to whom much is given, much is expected. It is our year as nurses and midwives to develop capacity. You cannot afford to leave that title nurse, please, I beg you. But instead, deliver.
Yes.
Yeah, instead deliver. So my advice to the general public at this time before we end the show is it's hashtag take personal responsibility for your life. That's the hashtag. Take personal responsibility for your life. Let me tell you, nobody's interested whether you are. See, I just want to say it as it is. People are dying. You don't get it. People are dying. Use your nose mask. Whether you are sick or you are well, use your nose mask. Somebody said I have respiratory challenges, so I'm not sure I'll be able to use mask. It's not comfortable. It's not. See, I have been using nose mask since 2001. I mean, that's when the first time I knew of something called nose mask that I have to wear for an extended period of time. Till date, I will tell you that nose mask is not convenient to use. It's not comfortable. Even me as a nurse, it's not comfortable. So don't forget about the discomfort you are getting. It is that you are protecting your life because you want to stay alive. You want to stay alive. That's it. So it's hashtag take personal responsibility for your own life and the life of everyone around you. Thank you very much.
Thank you very much. Thank you very much for coming on the show this morning. My guest, Nurse Jumoke. I don't need to talk that she really did a very fantastic justice to the topic. And I would like to thank you very much for coming. Dear viewers,